Welcome, everybody. We are glad that you are here to join us for our webinar today on empowering teams, improving care, optimizing patient safety culture surveys. So today we're going to have three speakers, myself, David Bertosh, the Executive Vice President at Configo Health, my colleague, Warren Boudreau, and also our special guest, Meredith Gerlin from Children's National Hospital. Our first speaker today is Warren Boudreau. He was the Quality Outcomes and Analytics Director at Texas Children's Hospital for many years. And at Configo, he leads our client success team. And one of his focus areas is around the patient safety culture survey administration. And so he's going to get us kicked off. So I'll turn it over to you, Warren.
Thank you, David. All right, so empowering teams, improving care. Let's jump in. So first topic really wanted to talk about is why does culture of safety matter? And because it's required, of course, is one easy answer, whether it's Joint Commission, DNV, or even some states that require a certain time frame to perform safety culture surveys, such as Florida in the example there. But why is it really required? Well, safety culture has an opportunity to improve outcomes for patients, where they benefit from reduced adverse events, for healthcare workers, where they benefit from improved job satisfaction, decreased burnout, or organizations, because organizations can benefit from the cost savings of both of those. So what is a culture of safety? Well, according to the Joint Commission, safety culture is the beliefs, values, attitudes, perceptions, competencies, and patterns of behavior that determine the organization's commitment to quality and patient safety. Great definition, but a little bit dry. At Configo, we strive to be on the cutting edge of technology, so this might be a great opportunity to leverage AI. So let's ask ChatGPT, what is the definition of culture of safety? Well, according to ChatGPT, it's like the Avengers of healthcare. Everyone's united to prevent any harm to patients or staff through proactive safety measures. So that's more like it. All right, so whenever we're administering safety culture survey at Configo, we follow the AHRQ SOPS Hospital Survey 2.0. And this is a validated and reliable tool that has been shown to raise staff awareness, assess current culture, identify strengths and areas for improvement, and monitor trends over time, and also evaluate the impact of safety initiatives. And if you're on this call today, most likely you've heard of the AHRQ SOPS survey. All right, so with that, we're going to jump into our second poll. And this one has two questions, the first of which, who takes a safety culture survey within your hospital? And how often do you survey staff on patient safety culture? So please take a moment to answer those questions, and then David will share the results with us.
Yes, and Warren, just while they're filling that out, we also got our first question. I'll ask that after we go through the responses. All right, so looks like most people have filled out the survey at this point. And so the first question, who takes the safety culture survey within your hospital? 64% of the participants said all of their employees, and 45% said that they have the clinical patient-facing staff only. So those were the two predominant ones. Then the second question on how often do you survey staff on patient safety culture? 73% said every 12 months, and then 27% said every 24 months. So about 3/4 of the folks do it once a year, and then about a quarter do it every 2 years. So let me close the survey, and then Warren, our question came in. The first question says, have you analyzed the link between safety events and the culture of safety surveys? I'm guessing because I shared that we also do track the healthcare acquired condition event data at the unit level.
Yeah, I would say we've started to look at um, identifying correlations between harm events and safety culture survey. The more frequent you do a safety culture survey, the stronger that correlation would be potentially, or at least it'd be a little bit easier to identify whether or not a correlation exists. And that's something that we do plan to look at whenever we're working with Children's National Hospital in their current SOP cycle.
Great, thanks.
All right, so I'm going to introduce Meredith. Meredith Gerland is an experienced public health expert who is passionate and committed to improving the quality of healthcare for all patients. Ms. Gerland is currently the Director of Patient Safety at Children's National Hospital, a top 5 pediatric hospital in the country. In this role, she leads the patient safety team and partners with key stakeholders throughout the organization to improve safety, quality, equity, and outcomes. Prior to joining Children's National, Ms. Gerland was a managing director at the National Quality Forum, a nonprofit membership-based organization committed to driving measurable improvements in healthcare. Ms. Gerland also has experience leading quality and safety initiatives at the Johns Hopkins Health System, where she helped lead the infection control program. Ms. Gerland has served as a subject matter expert and consultant for the Centers for Disease Control and Prevention, World Health Organization, and United Nations. She has deep experience collaborating with individuals across all sectors of healthcare, including frontline clinicians, healthcare executives, federal agencies, payers, pharmaceutical companies, and researchers. With that, I'll hand it over to Meredith.
Great. Thank you so much, Warren. And thank you to Configo for having me here today. I'm really excited to be talking about something that's super important to me, the safety culture survey. So as you mentioned, I'm the Director of Patient Safety at Children's Hospital, and the safety culture survey is a big piece of what we do on our team and a really important piece of assessing culture within our organization. So we do gather safety data a lot anecdotally throughout the year, but having a more formal and more structured way to gather and analyze the data through the safety culture survey is hugely helpful to our patient safety team to understand trends, progress, and the opportunities ahead of us to continue to drive change within the organization. I will also say, of course, our patient safety team is always thinking about and assessing safety, but of course, we recognize that isn't the case for every single person within the organization who are balancing many, many priorities each and every day. So we really leverage the safety culture survey as an opportunity to raise awareness about patient safety and staff safety and engage at a deeper level with both frontline staff and our hospital executives and leadership, and really look for ways that the survey can empower our frontline staff. And I love that the name of this webinar is all about how we can empower our teams, because we really think about the survey as a tool for empowerment. And to me, there's something really empowering about sharing with a frontline clinical team member that we want them to speak up for safety. We're taking direct action as a result of what they're sharing with us, and then we're bringing them along the way. We want to engage them in the process. We want to look to them to help us come up with solutions. So, in that vein, we really leverage the survey as a platform to promote safety and allow it to serve as a starting point for conversation. So it gives us that extra opportunity to not only promote taking the survey, get that higher response rate, but also promote safety as we think about analyzing the results in action. So this is a topic that's near and dear to my heart. And you can go on to the next slide, Warren. And so anyone on this call, I know it sounds like there's sort of a smattering of quality, safety, HR professionals. Anyone who's launched a safety culture survey, or really, especially for the HR colleagues on the line, anyone who's launched a wide scale survey in a health system knows it's a huge undertaking. So given that, there's a number of reasons that Children's National has used and partnered with external vendors to help facilitate the survey process versus entirely keeping it in-house. And we know there are organizations out there who are able to take this on in-house solely. But for us, the right fit has been looking to gain a little bit of support from an external vendor. So just to share a little bit about, why we've gone that route the last several years. The employee confidentiality piece is hugely important here. So we've recognized that our staff need to know their results are protected and are anonymous from our hospital leaders and leadership. And without this foundational assumption, we know we would not only get a lower response rate, but perhaps inflated results, which we certainly don't want. So partnering with an external vendor has allowed us to clearly articulate to our staff just how their data will remain anonymous. Even if we were to do that in-house, I think there's always a little bit of perception of uneasiness and unsure of how things are really protected. So it allows us to be really clear where the data flows, how we protect identities, who can see the identities, and really double down on things being anonymous and making sure staff really feel comfortable with that. So that's a huge piece for us. And then the other huge piece, as I'm sure many of the pediatric hospitals on the line today can relate to, is simply resources. Our patient safety team at Children's is small but mighty. We only have 3 FTE positions on the team. So we're quite limited on the resources that we can devote strictly to the patient safety survey. And so we've heard, from fellow hospitals, it can take half time of a dedicated FTE for many, many months to prepare for a survey, not to mention all of the post-survey work that we all look to after we launch a survey in terms of analysis. So, as we reflect, if we were to devote those types of resources, we'd really have to halt a lot of the safety work that we do on a day-to-day basis that helps keep our patients and staff safe every single day. And so we weren't really wanting to go that route. We wanted to make sure we were able to continue our daily tasks and our daily work that we do every day in the patient safety department. And thinking about the life cycle, and I think Warren's going to talk about this in a little bit, but the life cycle of the survey launch, everything from project management to mapping our leadership chains and where employee results should go, the IT testing and development, the analysis, slicing and dicing the data in different ways. They really add up in a lot of resources. And so it was essential for us to think about how do we get a little bit of additional support with all of those pieces along the way to help alleviate the burden on our small patient safety team. And so on the next slide, Warren, we can talk a little bit about why we've partnered with Configo to help facilitate the launch of our safety culture. So we've partnered with Configo for the last few years on administration of our survey. We recognized we really needed a partner who would not only prioritize our unique needs at Children's National, but remain flexible and nimble with us throughout the process as we make adjustments and learn in real time and do our own PDSA cycles. And so wanting someone that's going to prioritize was really important for us. And then also an organization that we could have a really close partnership with and be frequently conversing with. So, we meet with Configo quite regularly, and that enables us to give feedback on what we feel like we need to make the survey process successful and where adjustments are needed. And Configo has been really nimble to make real-time adjustments to help suit our need and set us up for success, which is quite important and really indicative of the relationship we were looking for with the vendor to launch this survey. And then, of course, they have the capability to leverage our historical data, which helps us look at how we're doing as an organization, compare ourselves from 2 years ago, and think about if we're moving in the right direction and where some gaps are. Let's pause here for a poll question. So this should pop up, and would love to hear from all of you. What are the biggest challenges that your organization faces related to the SOP survey?
And Meredith, while they're filling out this poll, a question did come in for you on how often how often does Children's National administer the SOP survey? And what led you to choose whatever option you have?
Thanks, David. That's a great question. And it was interesting for me to hear the breakdown of results when we posed this to the group just a few minutes ago. So At Children's National, we typically fall between that 18 to 24 month window rather than that 12-month window. And so, you know, we've really looked to that to make sure that we've allocated enough time to really take action on the results of the last survey. So we want to make sure we're able to share back with staff, here's what we did from the results that we got when we did this a year and a half or 2 years ago. And so that's why we're looking at this again now. So we really didn't want to rush that, and we've been closer to that 24 months.
All right, well, we've had, we're getting a few more responses now. So the number one challenge that people described, at 63% of the people said that response rates was the number one challenge. The second challenge was 50% was the creation of action plans. And again, people could choose more than one option. And then let's see, time and resources to do it. 33% said that was the biggest challenge or one of the biggest challenges. And then a tie with 22% of the people saying these were challenges, competing priorities, and leadership engagement. So I don't know if you have any comments on how those
Yeah, when I saw the pop-up with all of the options, every single one of them resonates with me. And so it's not surprising to me that that response rate comes out really high on top, and the creation of action plans as well as time and resources. So at Children's, we're no different. We have the same struggles. All of those things are challenging to us too. I will say, you know, actually you can go to the next slide, and I can talk a little bit about the response rate, because I think that can be really challenging, especially in the environment we're in, where it feels like there's a new email blast every week, there's a new survey every week. And so it's trying to get that captive audience to feel really engaged, to be able to respond. So in 2022, which was the first year we partnered with Configo for our safety culture survey, we had an overall response rate of about 55%, which we were really happy with. So historically, we've been lower than that. And I think in 2020, we were just under 50%. So we were trending upwards in 2022, and we're just about to launch in 2024. I'll talk about that soon. So really eager to see what that will look like as well in terms of response rates. And some of the really critical things that we've done to achieve that 55% response rate is really around the proactive follow-up. And Configo actually helped facilitate that a lot with reminders they've helped send out for tracking and for response rate. So we always look at the analytics and are able to see that push in response rate once we do send out those targeted reminders. And I would say in 2022, we took a really proactive approach to follow up. So visiting areas, rounding, using it as an opportunity to talk with staff, have that open dialogue that I was just talking about a couple of moments ago. And then something else we've done with the support of Configo was thinking about how do we compare certain clinical areas or department leaders to the rest of the hospital. And so we know that most people like a little bit of healthy competition. So in some targeting messaging, we can share that a given leader's response rate is X, and that's lower than the hospital average of Y. And we're really looking to them as support. And so when people see their numbers and that they're trending a little bit low the goal or the average, that's usually a good reminder for them to help be a little bit more proactive with their own team. So, you know, I think there was a question in the chat about how we achieve that. So that's some of what we've done in the past. But thinking back to 2022 and our survey experience, we did feel a really tangible difference in the speed and accuracy of the survey reporting and the results. And then increased attention and internal focus on action plans based on those findings. So I know in that poll just a few minutes ago, action plans came up as a challenge. And I will say Configo has really helped us think through data that would be meaningful and think through data a little bit differently that we collect, and has pushed us to think about things in different light. Which has enabled us to tailor our action plans a bit more based on the findings. So that's been helpful for us as we think about action planning. And then moving along, I mentioned we're just preparing to launch our 2024 survey. imminently in the coming weeks. So we're really excited about building on the work of 2022 to make the survey experience even better for our frontline staff and leaders who receive the tracking updates and the compliance and response rate, as well as the action plans and really our pillars in driving change after the survey. So some of the things I'm excited about, that real-time response tracking. So I mentioned it a couple of minutes ago, but really being able to leverage the real-time aspect to do targeted outreach and increase reporting response rate. So looking at, exact response rates as of a given day and being able to go right out to that unit and talk to people on the unit and encourage them to take the survey is really, really powerful versus getting that information a week later, 2 weeks later, once the survey closes, when there's not that much that we can do about it. We're also going to be looking at some direct side-by-side comparison results of those key groups to understand meaningful differences and where things are different, if they are a meaningful difference, or if that is natural variation. And then, like I mentioned a couple of minutes ago, Configo's really supported us to look at data in new, meaningful, and different ways. And so one of the things that I'm excited about is that we're exploring the relationship right now between our safety culture results and other key data points, like employee retention, employee turnover, safety event rate. So a lot of that is in its infancy. I don't have great data or results to share on that. Perhaps if I'm invited back in 2 years, we can talk about that experience. But I think it's really innovative for us to think about, how do we overlay employee engagement, employee retention with safety culture results? Are there indications of in certain units that score high on safety culture, score low? What does that mean for us in terms of risk of retention? So all of that is early stages, but really, really exciting to think about how we can partner with others in our organization about those hot topics. And I think that brings me to the end of my slides here. So let me turn it back over to you, Warren, and I'll keep my eye on the chat too, in case any questions come in.
Awesome. Thank you, Meredith. All right, so we're going to talk through the SOPS optimization process and the process that we deploy when we work with Children's National. So the first phase of that process is sitting down with the hospital team, the safety team, and finding out what historic data is available, even if it's not data that we helped collect. It could be in different formats. It could be from other different vendors. We'll take whatever you have, whatever each hospital has, and do our best to turn that into benchmarks, and have been very successful in doing so historically. Additionally, we start early on trying to identify key contacts in the IT team, legal, comms, just to start working towards our go live and survey launch timeframe. It's great to get those partners engaged early to avoid hiccups later down the road. And then, of course, getting a list of all employees. So here's an example of an employee list. Typically, HR provides that employee list. And in conversations with Meredith, one of the things that we do is we map out the leadership hierarchy for each individual employee. Do they report to a supervisor, a manager, a director, and then who is the executive, senior vice president? If it's on the clinical side, who is their medical director or chief? Just ensuring that we have the appropriate roll-ups so that we can create reports that allow us to look by department or by section or by executive role. So it just gives us a lot of flexibility in our reporting, and that's something we do on the back end that I know Meredith has appreciated. All right, the next phase of our Configo process is planning the survey launch and creating a project plan or Gantt chart. As Meredith mentioned, there are a lot of moving pieces with getting the survey right. And even just getting that initial employee list, sometimes that can take a few weeks, depending on how responsive your HR data teams are in generating it. But what we really try to do is create a project plan that has everything we can think of so that we don't forget about something and then a week or two before go live, oops, we should have done this differently. So we definitely help manage the project from the start. After that, we create the survey. We base the survey off of the AHRQ SOPS 2.0, but we allow each hospital to customize their survey. So we'll create a unique survey. We'll brand it in the hospital's logos. We'll add additional questions based on internal priorities or even some of the supplemental questions that AHRQ provides. And then we'll start the user acceptance testing early. So this is where we partner with IT to make sure emails are received, hyperlinks that go to the survey platform work, and there aren't any issues, so that when we send it out to staff, we know that they're receiving the survey and able to complete it.
Hey, Warren, let me jump in just for a moment. We got a question and it seems like it's the right time to ask, given you're talking about the process. Question came in, says, what is the level of engagement needed between the hospital and Configo for the survey process? So how much engagement is required?
Yeah, maybe I can start and then Meredith can add in. From my perspective, when we make our project plan, we try to design it in a way that brings all the decision points to our safety leadership team. And so timeframes are very important. How we want to deliver communication to our leadership teams as well as to the employees that are completing the survey, what type of roll-up reports we want. So there's a lot of decision points that we need our hospital partners to decide upon, but we do have the ability to leverage best practices from past experience and what other hospitals are doing, so we can make recommendations. Meredith, would you add anything?
Thanks, Warren. That sounds right to me. I think, my guess would be some of it probably depends on the preference of the hospital too. So, we've chosen to stay pretty close to the process. So we do have weekly meetings with Warren and the team, especially as we prepare for launch. And so having that level setting at the start with that project plan that was just shown on the screen as like a snapshot has been a really helpful tool for us to gauge our own resources and where we might need to have more frequent touch bases or where we might be able to scale back on them based on sort of the upcoming deadlines and the launch date that we've developed together.
All right. The next stage in the journey, as we kind of just alluded to, communication is very important. How we craft the invitation to clinical staff, frontline staff, or if we're sending the survey to all employees, how we craft the messaging, if we need it to align with other internal messaging or events, is always very helpful. And so we provide scripting for the various stages of our survey. So if at survey go live, our message may be a little bit different than 2 days prior to survey close, where we have a little more urgency. So we try to script all of those and partner with the hospital to customize them to suit their needs. All right, next phase is launching the survey with access to real-time reporting. So I'm going to show a couple of examples of the type of real-time reporting we provide. So immediately at survey launch, this is a response rate tracker report that works as soon as the first results come in. The nice thing with this response rate tracker is it allows us to track responses by date, by day of the week, by hour of the day. And then that bottom table, we can filter that for department or any of those levels of leadership to see how their teams are responding and compare, different managers or directors or executives to let them know, maybe their colleagues are outperforming their areas of operation. And so this has also been really helpful to target our outreach. So we are able to only send reminder messages to non-respondents, and we've had a lot of positive feedback by targeting non-respondents. That way, anyone that does fill the survey out, they're not getting bugged by emails every week or every few days asking them to complete the survey. And so in targeting non-respondents and leveraging this type of information, we may determine that we're missing night shifts or we're missing weekend shifts. And so we can do some targeted messaging for those groups and also time our outreach so that it's the first thing they see when they start their shift. And another example of real-time reports, and truth be told, a lot of our reports are going to work right away when the survey goes live. So we could track some of those preliminary results. This is just an example of the type of table that we can do group comparisons on and heat maps on using, standard deviations from the mean, who's performing well, who's underperforming, at the leader level, at the department level, or by clinical role. And we found that this type of visual, it makes it very easy and quick to identify some of those areas where more attention may be needed. Right, and then the final phase is closing the survey and doing our post-survey analysis. So we actually have the initial results available within 24 hours of closing the survey, and the final analysis completed within 10 days of closing the survey. And so again, this is based on our level of engagement with the safety leadership team, the executive team at the hospital, just to decide who should be receiving reports and how they want those reports to look. I'll show a couple of examples. So in this one right here, this is a department report where we show the various domains at the top and bring in benchmarks from the previous survey or an AHRQ benchmark. In the bottom section, we can flag the individual questions that had the highest performance or maybe the biggest opportunities. And these are the type of reports that we actually have the ability to automate distribution for. So if every supervisor, every manager, which may be in the hundreds, depending on how large your organization is, if every manager needs to receive a copy of this report for their direct report team, that's something that we have the ability to automate. Many times when you don't have data, your focus is on how do I get data, but once you have it, the focus quickly becomes how do I distribute this information? How do I get it into the hands of leaders that need to use it for decision making, for action planning? And so we try to really help make that process much easier by delivering PDFs and CSV files with all the free text comments, because there's a few fields on the survey that are free text, or one field in particular. And we deliver that via email to each of the necessary leaders. And at the executive level, sometimes you want to bundle maybe multiple departments together. So maybe one executive has 5 departments that they're accountable for. We have the ability to bundle all 5 of those together into one email to really make it a clean, efficient process and not bug executives that have a lot of departments or a lot of leaders that report up to them. We don't want to send them, a million emails. This next one, this report right here was based on a separate client request. They wanted to look at the AHRQ percentiles and see how their results compared to those percentiles. And of course, all this data is mock data, but this was one way we visualized how that system in this example, or filtering it down to a specific department or clinical role, we could compare the results for their group to the AHRQ percentiles to make that information a little bit more friendly for interpretation. And then Meredith, you might want to comment on, or maybe after this one. So this is an example of sentiment by clinical role. So we've also been able to use natural language processing to take the free text responses from the different surveys and do a sentiment analysis. And then we can perform that sentiment analysis by clinical role or leader or department. And it's been pretty interesting to see how different leaders have disparate results. And then finally, this last example is a word cloud that I know we made for Children's National in 2022, and they enjoyed being able to visualize those words. I'll say this is a mock data slide. Go ahead, Meredith.
Yeah, Warren, I really like the sentiment analysis because it's kind of a quick and easy way for us to get a snapshot of what's in those free text fields. Obviously, there's a lot of data that comes from the free text, and it takes some time to actually read through all of those comments and pull out the themes and understand what's going on. So just as sort of a quick way to get a high level sentiment of what are those words we're seeing again and again, and then leveraging that as we think about when we share results and to which groups, that's something that's really helpful for us, especially, you know, if we haven't had the time yet to read through every single comment. So I really like the sentiment analysis here.
Thank you. All right, and I think we're moving into Q&A now.
Yes, so for those on the call, please take a couple of minutes to send in any questions you have for Warren or Meredith. We'll take a couple of minutes to do that. It looks like we have our first question in. What is the best way to maximize the impact of the SOP survey?
Yeah, I can start and talk a little bit about, you know, some key principles at Children's that we think about in order to maximize the impact of the survey. I think first and foremost, not being afraid to drill down into the data, as Warren just showed. There's a lot of information that comes out of the survey. Those on the call who have launched the survey know that already. But not being afraid to look at the data in different ways, not being afraid to be innovative with how you look at the data and understand what's going on. And then I think another big one is transparency. So not only sharing those opportunities for improvement, but sharing the successes as well, and making sure that the narrative that you're talking about will really resonate with the group that you're thinking through the presentation or the sharing of the results with. So you know, for us, I'm always spending a lot of time thinking about the audience when we talk about results of safety culture and how that message might look a little bit different to a board of directors or a C-suite level group or a frontline staff. And so there's similar data, but sometimes it resonates in different ways. So I think being able to understand those nuances and understand what's the most meaningful way to make the connection with the group you're sharing the results with is really, really critical. And then I'd say the third thing that's really important for us in maximizing our impact is alignment. So we all know there's a million priorities. There's a lot of strategic goals. There's a lot of work in different departments that is boiling up. And so for me, I really try to think about how does this work and how do our opportunities for improvement here tie into our larger strategic goals and our vision and our plans. And so trying to make those connections to help prevent goal fatigue, help prevent people from feeling like the safety culture isn't a priority and it needs to be on the back burner because of other priorities, but really tying it in to make it all part of that same broader initiative, I think is really critical for maximizing the impact of the safety culture.
Yeah, I would add one additional comment. So response rates are very important to ensure that minimum thresholds are met. So the AHRQ survey has a threshold of 5 responses as the minimum to provide summary results and 10 responses as the minimum to provide free text response, just to protect the anonymity of employees that are completing the survey. And so one thing we've done with Children's National to, I would say, maximize impact is take some of the smaller departments that wouldn't be able to meet those minimum thresholds due to the size and just the denominator. They don't have 5 or 10 employees maybe, and grouping them with other departments that are similar, and then creating kind of a new group of employees that we can get the minimums for and create data for. And that makes it a little more impactful in that they're not just being rolled up into a campus or a location or a larger group. It's still closer to the actual work that they're doing.
Great. Thanks, Warren and Meredith. There's, I don't know if you see, Meredith, the other question that just came in says, on that note, what is your advice for organizations that struggle with leader engagement? What are some ways to improve the leader engagement?
Yeah, I think this can be really hard sometimes. My advice would be trying to take a step back and figure out, what is the barrier to leader engagement? Is it time? Is it priorities? Is it resources? And trying to understand that, and trying to engage, those particular leaders early in the process to help get them to buy into it. So instead of just springing on them in a leadership meeting, hey, this is coming next month, next week, when you start the planning of it, maybe sit down with that leader and say, we know there's a lot on your plate. We're thinking this is the right time to do the survey. How does that feel? What are some challenges? What are some barriers? And trying to head it off early by pulling them into the process and getting them as an engaged and invested champion of it. Anecdotally, I can share, we've had a leader in the past who sent us all sorts of feedback on the survey and the things they didn't like about it and challenges with using it. And so what we actually did the following survey year is we identified that person as one of our small cohort for that user acceptance testing that Warren spoke about earlier. So we reached out to them. We said, we know you gave us tons of great feedback last year. We'd love for you to provide early feedback in our development process. So just one example of how you can pull them in earlier and get them a little bit more invested, a little bit more engaged, and then feel a little bit more compelled to be a champion for the process.
Yeah, and the only thing I would add, just generally, is how do you best, and depending on what level of leader we're talking about, but trying to tie the results back to a goal that's important to them, some metric or goal that's important to them, so they can see how the survey results and the action plans that follow will benefit them as well. All right, another question came in. Have you asked any additional questions in your survey or thought of combining surveys? If not, why not? So,
yeah, this is a great question. So let me answer the second half of it first. The thought of combining surveys. I feel like there's a lot of momentum in the field to think about the employee engagement survey and the patient and the safety culture survey. And if there's a natural alignment between those two and consolidating those. So we have not yet done that at Children's National, but it's something we're thinking about and trying to explore the pros and cons of that approach. So that's something that is on our radar. And if you're an organization listening that is doing that, I'd love to connect and learn more about that process for you. And then for the first part of the question about additional questions in the survey, we have had additional questions that we've added that we've gotten really valuable insight on. So back in 2022, we added a couple of questions specifically related to the electronic health record and understanding how people are satisfied with it, and then understanding the speed in which people feel like problems with the EHR are resolved in a timely manner. So that was helpful as we think about challenges with the electronic health record and how that overlays to patient safety. The other questions we had in 2022 that we're also keeping in 2024 were around physical and verbal violence towards our staff members. So like many healthcare organizations, staff safety is an utmost priority for us. And we do see, certain periods in time where it feels like there's an uptick in events on our staff. And so we have a lot of work around this and a lot of working groups focused on this, but we do add in to the safety culture survey, 1 or 2 questions around physical or verbal violence, and trying to get a sense of how frequently people are experiencing it. We do ask people to, of course, report these incidents, but we know things can go underreported, and so this just gives us another data point to look at. And then I think it also sends a nice message to our staff as we think about the other questions in the survey about patient care, but really putting on the same playing field staff safety and caring for our staff members. So those are the questions we focused on at Children's.
That's great. That's a great response, and great question, because I know I've talked to hospitals that have taken various approaches as well to the survey. One thing I would add to, and I don't know who sent in the question, but we do have the ability to not just do the patient safety culture survey, but add other questions as needed. And I've been with Configo about 6 months, and I will tell you, one of the common threads of feedback I get from hospitals is, compared to other vendors, we make their lives easier, not harder, when they engage with us. So whether it's for one of our data programs or through our surveys, one of our goals is not only to give you actionable results that are meaningful, but also to make your life easier, almost like we're an extension of your team. So just throw that in there as well. Warren, do you mind? Yeah, thanks. So we've got on this slide, as we wrap up, getting close to the top of the hour. Here are our email addresses. We will be sending out a copy of the slide material. So if you do want to contact us afterwards, we'd be happy to answer any questions you have. Again, it doesn't have to be specific to Configo, but just any questions you have about the patient safety culture survey. Or obviously Meredith has her awesome background from a patient safety perspective, both at Children's National and other organizations she's been at before. So, so with that, let me just take the opportunity to thank you, Meredith, for providing your time to this presentation, and Warren as well, taking time out of your busy schedule with the hospitals to share your knowledge with the broad audience here as well. So with that, thank you, everybody. Have a great rest of your day, and we'll hopefully catch you next time for our next webinar, kind of TBD on the topic. So thanks very much, everybody.